There are studies in the US and Denmark and other countries that possibly are not as rigorous as this study. This is probably the benchmark study that we've seen so far, and it confirms some of the other population-based studies that have suggested this fascinating. Perhaps not fascinating for the people who have the stroke, but fascinating to us. Why are people under 55 having more stroke and people over 55 having less? There are a number of factors involved, but I think partly in the older population we are much better at controlling the traditional risk factors for stroke and heart attack which overlap, including particularly high blood pressure. But it looks like in the younger population there are other risk factors that are emerging that might be relevant that aren't considered traditional risk factors. Stress, which obviously you were just talking about with your previous guest. The studies show that the other fascinating thing, apart from the increase of stroke in younger people, it was actually people of higher professional working standards, so these were people in professional and managerial positions who had significantly increased rates of stroke compared to people that were in more manual labor. Just the opposite from what you'd expect, given that you've got the health gap normally. Yes, except that perhaps these people are probably under more stress at work and they certainly exercise less than people in more manual labor positions. Could it also be that we are asking general practitioners to focus on the over 50s and do their absolute risk scores? What are your chances of having a heart attack or stroke in the next 5 years? And miss the fact that if you are younger, your blood pressure is up a bit and your cholesterol is up a bit, you are actually at risk, but no one is really focusing on that. That may be part of the explanation, Norman, but the authors actually looked at that and found that hypertension in the patients that had stroke under 55 was higher than the rest of the population, but it didn't explain the overall increase, so there must be something else going on. So the message here is, again, for doctors to think about the psychological and social situation of the person in front of them? Absolutely. I'd have to say, listening to Professor Kissler, neurologists are actually generally pretty attuned to their psychological health of their patients, but sometimes when you ask about that, it's not always met with joy because they think it's all in my head, doctor. Exactly, so I think there is education needed for the general population as well, not just briefly, and this is in your lane because you are an interventional neurologist. You like sticking in catheters and removing clots and things like that. This was a study of stents versus medical therapy in people who had already had a small stroke and they found no benefit. I'm not sure you necessarily agree with the findings. Firstly, I actually don't stick the catheters in, but I am a neurologist that treats acute stroke patients and works very closely with lots of interventional neurologists and radiologists, and yes, we stick catheters into lots of our stroke patients. But typically we mostly stick catheters into our patients when they are having an acute stroke in the first 24 hours, and we can talk